Good morning, everyone. My name is Jose Plaza, and I'm excited to welcome you all to Maclay Wellness Center here at Northeast Valley Health Corporation. We are excited to have everyone here today as we recognize the efforts of Assemblywoman Rivas in securing state funding for NEVHC in the amount of $5 million. This is a historic gift for us, and we're really excited to not only have Assemblywoman Rivas here, but staff and friends of NEVHC. It is my pleasure now to introduce Kimberly Ward, who is our CEO. Kimberly has been with NEVHC for nearly 50 years as we celebrate this upcoming year, our 50th anniversary here in the Valley. So thank you for joining us, and Kimberly, the podium is for you.
Thank you so much, Jose. And of course, I am beyond thrilled, and I want to thank the Assemblywoman and her team for working with my team to bring to fruition, as Jose said, this historic gift. When I came to Northeast Valley Health Corporation in 1974, I was a 22-year-old intern, and I thought I would be here for 6 months and then go on. And instead, I think I fell in love with community health centers and the work that we do in the most vulnerable and underserved communities. And today I have the pleasure of being the CEO of Northeast Valley Health Corporation, and it's a constantly changing and growing and expanding organization. The gift that Assemblywoman Rivas has made possible for us will help us continue to serve some of the most vulnerable communities in the San Fernando Valley. Our Pacoima community, which encompasses part of her district, is in a medically underserved area. It is in a health professional shortage area, and it scores in the highest tier on social vulnerability indices. So we are going to make good use of this money, and we pledge to be good custodians of these funds. We have a partner here at the Maclay Wellness Center, and I do want to give a shout out to LAUSD. I don't know if Ron Tanamura is here with us, but he had hoped to join us today representing LAUSD in this health center. We not only have Northeast Valley Health Corporation staff, but we are co-located with LAUSD behavioral health staff. This health center opened in the middle of a pandemic. It opened in November of 2020, and today it will serve 10,000 visits, patient visits, provide those visits here in this community. Overall, Northeast Valley Health Corporation operates 17 locations, will provide services to over 80,000 unique patients, and those patients will provide over 300,000 visits. Specifically, we are going to use this money to help sustain some of the work that we started using taxpayer funds, the American Rescue Plan funding that was afforded to us by HRSA. We will continue our Care in the Air testing, COVID testing sites. We will be able to continue our vaccination clinics. We operate both community or family vaccination clinics as well as express immunization clinics. We will continue to do the work to stabilize our staff, to build capacity. Staff recruitment, retention, and training is built into this grant. Our homeless patients will benefit as we will be purchasing a vehicle to help support our homeless street outreach team who go under bridges and into washes and have to reach the hardest to find and hardest to serve people experiencing homelessness. So there's a variety of things that this money will go to support, and we're really excited to have this opportunity, and it comes at a really good time in our organization as we are expanding and opening new sites, and we need, and we do need the funding. So I thank you very much. We pledge to be good custodians of this money. I want to give a shout out to Assemblywoman Rivas' staff who worked so hard to help with my staff to help put this together. Jose Plaza and his team, the staff at the Maclay Wellness Center. Thank you all for being here. And to everyone who has a hand in supporting community health centers. I like to borrow from the African proverb that it takes a village to raise a child. We say in the community health center world, it takes a community to sustain a community health center. It takes a village. And Assemblywoman Rivas, you are a mighty villager. So without further ado, I'm going to turn this over to Jose Plaza. Thank you all so much for being here.
Thank you, Kim, and thanks again for your continued leadership. I'd next like to introduce Dr. Christine Park. She's our Chief Medical Officer here at NEVHC.
Thank you, Jose. My name is Dr. Christine Park. I'm a pediatrician, and I have the privilege of serving as NEVHC's Chief Medical Officer, where I work alongside this amazing team of healthcare providers to serve our ever-growing San Fernando Valley community. Over the last 50 years, NEVHC has witnessed firsthand the health challenges faced by our LA County residents and has been a key provider to our predominantly low-income immigrant and underserved population. Because of this community that we serve, our life-saving work is that much more impactful. And because the needs of the community are so great, this funding will mean that our services, our clinics, and the excellent care that our staff provide will be about 5 million times better. In 2021 alone, we saw more than 400,000 patient visits, served nearly 80,000 unique patients, provided care to about 25,000 pediatric patients, administered over 55,000 vaccines, and vaccinated more than 28,000 patients. Our 11 WIC sites saw nearly 500,000 WIC visits, and we served nearly 4,000 patients experiencing homelessness. COVID has pushed us to reimagine our care delivery services, work with our patients to meet their respective needs, and evaluate our own systems and technology to provide quality and accessible care. Even though we've made great strides in providing that care, it has become apparent that we need to revisit our staff retention and staff recruitment practices, modernize our equipment and infrastructure, and be ready to welcome back pre-pandemic numbers of patients. As federal funding expires this year, this funding will provide the critical support needed for us to continue recruiting more top staff, retaining our excellent healthcare providers, and modernize our medical equipment to meet the ever-changing dollar figure, but also in terms of the impact that it will have for NEVHC patients and the overall health of the San Fernando Valley. Assemblywoman Rivas has been a long-standing champion of the 39th District and the health of our residents. She was our steadfast partner when COVID-19 hit. She's supported myriad programs of ours, and she has passed legislation enshrining the protections for youth and for our environment. Health centers across the country serve more than 27 million patients, and 1 in 10 children receive care in a health center. Northeast Valley, with its more than 1,000 employees across 17 locations and its nearly 80,000 patients, are beyond grateful to the commitment and continued investment from Assemblywoman Rivas. I'd like to take another minute to thank our staff from Team Rivas and Team Northeast Valley for the work that went into securing funding and putting together this event. Jose?
Thank you, Dr. Park. Next, it's my privilege to introduce Assemblywoman Rivas, but first let me give you a bit of her amazing bio. Assemblywoman Rivas was born in Los Angeles to an immigrant family and grew up in the Northeast San Fernando Valley. She attended LA Unified Schools before earning a bachelor's degree in electrical engineering at MIT and a master's of education from Harvard. Assemblywoman Rivas was elected and sworn into the California State Assembly in June 2018. Since then, she has been appointed as chair of the Assembly Committee on Natural Resources and currently serves on the Assembly Committees on Budget Subcommittee number 3 on Resources and Transportation, Health, Local Government, Revenue and Taxation, and the Joint Legislative Committee on Emergency Management. She is also the chair of the Select Committee on Nonprofit Sector and serves on the Select Committee on Latina Inequalities and Select Committee on Coastal Protection and Access to Natural Resources. During Assemblywoman Rivas' time in the Assembly, her priority has been to uplift and empower underrepresented communities. She has been extraordinarily successful as a leader in delivering substantive policy such as reforming the state's response to homelessness, providing universal school meals to all K-12 students, creating the California Youth Empowerment Commission to increase youth civic engagement, and advocating for environmental justice through her role as the chair of the Assembly Committee on Natural Resources. We are lucky to have her represent the 39th District. Help me in welcoming Assemblywoman Rivas. Assemblywoman.
Thank you. Good morning, everyone. Thank you for being here today. I'm Luz Rivas. I represent this community in the State Assembly. I grew up not too far from here in Pacoima. Before I begin, I just want to thank Kimberly Ward, the CEO of Northeast Valley Health Corporation, Dr. Park, and Jose and the Northeast Valley team for joining me here today and working with my team to make this state investment possible. One of my priorities as a legislator has been to ensure that the communities here in the San Fernando Valley, especially the most underserved communities, have access to health care. And that's why I'm excited to be here to present this $5 million investment from the state of California to Northeast Valley Health Corporation. I grew up in this community years ago, as long as probably Northeast Valley Health Corporation has existed. And I remember the challenges that my family and other families that are from this community had in accessing healthcare and dental care. A lot of times our parents, I grew up with a single mother. Sometimes she didn't have a job that provided health insurance, so we relied on services that were available. But back then, there weren't as many accessible health services. And that's why it's very personal to me. I want everyone in this community to have high quality health care. And that has been one of my priorities. And today I'm able to deliver that in my own backyard. And that's why I'm very excited to be here. This $5 million will be used to buy equipment, medical equipment, to provide high quality health care. As mentioned earlier, a mobile health unit for homeless individuals in this community, and other services that will improve reproductive health for women in the Northeast San Fernando Valley. And so I'm very excited to be here to deliver this $5 million investment in healthcare for the Northeast San Fernando Valley. I know my family and other families that grew up that lived in this neighborhood and still do will be excited that others will benefit from this investment. Most of my work in the State Assembly has been at the intersection of climate change and public health. I'm a member of the Health Committee in the State Assembly. I'm the chair of Assembly Natural Resources, which works on climate change and the environment. And those are issues that affect us in this community with these extreme heat waves that last month we suffered through. As many of you know, the San Fernando Valley is one of the hottest areas in Los Angeles. We always reach over 100 degrees, and it affects health, people's health. The most vulnerable residents may get a heat stroke. A lot of homes in this area don't have air conditioning, and it exacerbates any health issues that they may have. And in addition, we think about the air quality around here. Lots of children have asthma in this community and need access, especially at their school. This Maclay Wellness Center is here co-located at middle school in our community. So I'm excited that we are able to deliver this high quality healthcare from this investment. And I want to invite all of the Northeast Valley healthcare, individuals that are here today and present this $5 million check to them. Oh, that's true. Yeah, the real check will be coming
Yeah.
soon.
So I want to thank everyone for joining us today. I do want to make a special recognition of our grants director, Eddie Sanders, who's here, who worked tirelessly with the Assembly Rivas team to secure funding. So I do want to give a special shout out to Eddie and all the work that goes into funding the myriad of programs that we have here at NEVHC. And so we'll open up if folks have questions. Otherwise, we will end the session. Thank you very much for joining us. All right. Does anybody have any questions? We do want to answer questions.